stable electricity and water supply. And just like the President also stressed the need for NABEC to increase its cash power sale outlets in order to sustain the current flow of customers in need of their service. Abdinjai, Grts.
We apologize for not being able to bring you highlights of the President's meeting with the board and staff of NABEC because of damages on one of the tapes. The program will, however, be aired by Grts Radio this evening and tomorrow at 10:30 p.m. The Vice President and Minister of Women's Affairs Wednesday morning presided over a meeting of sectors under her purview at the Nana Conference Hall. The meeting sought to review and assess progress made by the respective sectors towards the mainstreaming of the program for accelerated growth and employment page. The interface, as Mamoudou Jallo reports, also identified key strategies to be pursued to fast-track the attainment of set goals and targets.
This meeting of the President's Office brings together officials from the National Population Secretariat, the National Disaster Management Agency, Women's Bureau and the National Nutrition Agency to discuss key policy issues, review and assess progress made in mainstreaming the program for accelerated growth and employment page into their programs and activities.
When we come as sectors, the idea is to know whether or not they have been sufficiently mainstreamed, to determine whether or not the mainstreaming is adequate enough to ensure that we effectively contribute to growth and employment.
The meeting comes nearly 4 months after the Vice President, Her Excellency Ajay Dr. Aissatou Njie Seydi, toured the country to, among other things, see for herself the progress made and the challenges abound. This meeting therefore provides the perfect opportunity for the various sectors to present their work plans, outline activities, and highlight challenges.
Among those, we look at the activities, we look at the funding gaps, and we look at our activities vis-a-vis the government's development blueprints. For example, in the Gambia, we talk about Vision 2020, the MDGs, and PRSP2, and now PAGE. Come 2012, we have the Program for Accelerated Growth and Employment as a development blueprint.
For the participants, such meetings provide the platform to brainstorm and devise strategies of meeting set targets and expectations. This, the Vice President believes, is imperative on the various sectors under her.
There are some things that should be addressed at the level of the sectors themselves. There are things that should be addressed at the decentralized level. There are some things that we need to address in consultation with our development partners, or indeed in consultation with other government sectors. So each and every one of us have a duty and a responsibility.
The Program for Accelerated Growth and Employment is a policy document that would succeed the PRSP2 and has among its priority list employment creation for sustainable growth and poverty reduction. The Vice President is convinced that for any development to take place, jobs must be created and priority be given to Gambians.
So we look at those sectors and see what efforts are they doing to employ Gambians as opposed to employing non-Gambians. We are not saying you don't have to employ non-Gambians. If a non-Gambian comes into the Gambia, settles, and is the owner-manager of a business, we understand. There are some that are family businesses. But despite that, there must be a quota for Gambian employment, because there are a lot of our young people are looking for jobs. So I don't see any reason why a company should be based in the Gambia and you say, I don't have, for example, an accounts clerk. When we are churning out accounts clerk at MDI and at the University of the Gambia, and there are a lot of other universities abroad that have affiliates here.
The next meeting of these sectors will be in December, when they would have completed the outstanding tasks identified in this meeting and come up with the relevant strategies for action and implementation. Mamoudou Jallo, Grts.
The Director General of the President's Alternative Medical Treatment Program, Dr. Tamsin Bow, informs the general public that His Excellency Sheikh Professor Alhaji Dr. Yahya Jammeh will hold a treatment session for infertility patients at Kanilai on Thursday, 28 October 2011. All those who have registered for the infertility treatment are being urged to be at the Kanilai Alternative Medical Clinic in Bakau before 10 a.m. for the trip to Kanilai. Dr. Mbow is reachable on 991-4535 for further information. Celebrations marking World Sight Day were held in grand style at the Sheikh Zayed Regional Eye Care Center in Kanifing. The ceremony, graced by the Minister for Health and Social Welfare, as Aissatou Bajansa reports, also saw the official handing over of a new hostel for staff of the eye clinic and visiting lecturers.
Colorful event held at the Sheikh Zayed Eye Care Center, serenaded by cultural performances, saw the commemoration of World Sight Day the official launch of the Health for Peace initiative, and the handing over of a new hostel for staff, students, and visiting lecturers of the Sheikh Zayed Regional Eye Care Center. World Sight Day is commemorated the second Thursday of every October to raise awareness on blindness and the prevention of avoidable blindness. The commemoration in the country is being championed by the Health for Peace initiative, an ad hoc of sight savers.
The Gambia was in the forefront in making sure that this golden opportunity, which intended to bring peace in the sub-region, using health as an entry point, succeeds. The World Health Organization, cognizant of the importance of this initiative, participated and indeed provided technical support to the series of technical meetings held to develop the relevant health protocols and instruments for the effective execution.
The hostel for the regional ophthalmic training program, housed at the Sheikh Zayed Regional Healthcare Center, is supported by the Gambia government and its development partners such as the European Union.
The European Union is contributing with 4 million euros, which represent about 66% of the overall funding of this project. This project has laudable and at the same time very ambitious purposes. That is to establish comprehensive, good quality eye care services that are accessible and affordable to the vast majority of the population of Senegal, the Gambia, and Guinea-Bissau.
The Sheikh Zayed Regional Eye Care Center has trained 145 people. 75 of these are ophthalmic nurses, 70 cataract surgeons, and others. Just to mention a few, the Gambia of this has 18 cataract surgeons and 27 ophthalmic nurses. So Gambia is remarkably well supplied.
Sight Savers Regional Director also took the opportunity to present 6 motorbikes and 3 microscopes to aid in the swift response in tackling optimal cases. The materials presented to the Minister of Health and Social Welfare was handed over to the manager of the Health for Peace Initiative Blindness Prevention Component as beneficiaries. The Minister for Health and Social Welfare commended the Sight Savers and its supporting agencies for making eye care affordable and accessible to Gambians.
This center, which is one of the 5 components of Health for Peace Initiative Prevention of Blindness Program, HFPI, PBL, is indicative of successes made by the HFPI since its inception in 2001. The prevention of blindness component has added to the HFPI following the signing of the Banjul Declaration by health ministers of Guinea-Bissau, Guinea, Senegal, the Gambia in August 2001.
The climax of the event came when Minister Baji officially opened the new edifice and was taken on a conducted tour of the building. Aissatou Badian Sarr, GRTS.
Still on health, malaria experts from 15 ECOWAS member countries are reviewing the 2011 malaria roadmaps of the participating countries and developing new ones for the year 2012. Babukar Kamara now reports on the high-level convergence organized by the West Africa Lower Back Malaria Regional Network in partnership with the National Malaria Control Program and the Ministry of Health and Social Welfare.
High-level malaria conference for the 16 West African countries on the fight to roll back malaria.
We must be able to measure progress of our interventions, and verily that is the reason for us coming together, as a partnership, to look at what we have achieved, to look at the way forward for malaria control and prevention in our various countries.
According to officials, Sub-Saharan Africa continues to bear the brunt of the malaria epidemic due to inadequate resources. However, there still exist some remarkable developments underpinned by the strong commitments of West African governments.
The government of the Gambia is deeply honored to host this important meeting as malaria remains as a major public health challenge and problem in the Sub-Saharan Africa region. The government of the Gambia is therefore highly committed to malaria control and prevention, as it is an active member of all regional and sub-regional malaria networks.
Chloroquine was our mainstay for treatment of malaria. Today, as I speak, I think the arsenal
for